it's flu season, so everyone's focused on the flu. Flu symptoms, flu shots, all that jazz. But a lot of times people are neglecting this RSV, which is more predominant in the flu season. But it kind of gets looked over just because we're so focused on the flu. So there's one lady named Vanessa Lachey, her name is. I'm pretty sure she's an actor. I'm not sure what kind of movies she plays in or how famous she is, but she has a 1-year-old son. He was born premature. That's not really the issue at hand. But her son started developing like these flu-like cold symptoms. So he had a headache, or not really headache, but he had a fever for a few days that wasn't going away. He was a little bit lethargic. He wasn't acting like himself. He wasn't as active as he usually is. So she brought her into the doctor. Doctor did an examination, listened to breath sounds, and says it should go away. He should be fine. If they're planning on going on vacation, doctor said, it's okay. It'll clear by itself. What happened is they end up going on this vacation, and their child gets more lethargic, starts getting more ill. And they were out of the country somewhere. I don't know if it was Bahamas or somewhere. And they were not able to treat him with anything. Wow. So they took a emergent plane ride home, and they end up taking the kid to a hospital. And what comes up is that kid ended up being in the NICU for 6 days for RSV. Wow. So this is there's a simple test that we could do to check for RSV. It's just like a swab, which sometimes we would neglect because we don't really think it's that big of a deal. And for the fact that it masks the flu. So it has flu-like symptoms, cold-like symptoms, and it normally goes away on its own. But there's certain situations where it becomes severe, like for this kid. Normally, we would be able to fight off RSV without any kind of issues, but in this situation, it was pretty devastating.
Yeah, and the way we check for RSV in the hospital is we do something called the Respiratory Panel. And for those that know, it looks very uncomfortable. We basically shove a little metal wire with a little cotton material at the end, and we just go very deep into the sinuses. And we take it out, we send it on the lab, and what happens is that patient is on contact droplet in between that time period, meaning we're taking precautions, ruling out the virus that this person has. And I think RSV is pretty common, even in adults. And the statistic shows here that it's estimated that 57,000 children, 5 and younger, develop this.
Yeah, so it could affect anybody, but the most damage that it does is for kids that are below 5 and for our elderly. That reason being is because the immune system aren't fully developed and aren't as strong. But like I said, normally this goes kind of unnoticed because it goes away on its own. We get it, we fire it off, and we don't get it again.
Yeah, and this respiratory syncytial virus, known as RSV, the thing is it's a virus, and sometimes, like you said, it masks the symptoms, and sometimes we might just say, oh, my child is having the flu, oh, they're just cold symptoms, little fever, but we're neglecting the fact that this could progressively get worse, and we have to be aware of the signs and symptoms, right? And one thing why this disease is so severe is because it causes bronchiolitis. So literally the upper airway is swelling up and it becomes harder to breathe. And it also could cause pneumonia, which is just an infection of the lungs. It could be either bacterial or virus.
Yeah. So who is at risk? Like I said before, predominantly younger kids, so less than 5. But premature kids are more likely to get it because they're premature infants, so they came out a little bit sooner than they should have. Very young infants, especially 6 months or younger, children younger than 2 years old with chronic lung disease are also a higher risk, and children that are 2 or younger with chronic heart disease are also on higher risk, and people with weakened immune systems in general are higher risk. But the thing is that the symptoms are so common that people misrecognize it as a flu. So some of the common symptoms, early symptoms, you're going to have the runny nose, fevers, decreased appetite, cough, maybe a little chills. But once your kid starts wheezing, becomes irritable, starts to be like lethargic, then more lethargic than usual, and it kind of increases over time, that's kind of the time where to bring in. Or they become apneic, yes, where they decide, or where they stop breathing every once in a while they're sleeping. Those are kind of the later stages. And it's usually the care that we provide is more supportive care, just making them comfortable, like over-the-counter medication like Tylenol, just to decrease the fevers. But there's instances like this lady had where she brought her son in and ended up needing hospitalization because it got so severe to that point. And everyone's immune system different. It's not really clear on who's going to get it or not. It's just kind of a day-by-day approach.
And it's hard to just, tell you as a parent, it's hard to be like, okay, let me just take my, daughter or son, whatever, to the emergency department. Like, it's hard to differentiate that because it's so similar. So it's not bad to call your primary, pediatrics doctor or something and ask if, maybe we should, it's flu season, let's do a respiratory panel. I have no idea how exactly they diagnose kids. I'm sure it's similar, but just being proactive and just being aware of how your kid is. It's like, if you're not a nurse and you're like a mom or dad, just be aware of the baseline of your child and start, looking how he's progressing and what's happening, and hopefully your intuition tells you the right decision to make.
Yeah, if your kid's getting worse, there's no reason to wait any longer. Even if you go and like the doctor said he's fine, he'll get better, and if the doctor says, hey, he should get better and he's not getting better, that's definitely a good sign to bring him into the hospital. Some of the hospital measures that we could take besides the supportive ones is the kid's mostly going to get an IV just so you get hydrated, just so he has more volume, just so your kidneys can process all the fluid, all the toxins going through. You also want to give him humidified oxygen because no one likes dried oxygen, and it's kind of more support as well. Sometimes they'll get to the point where a kid might need to get mechanical ventilation, where they might need to get intubated and vented, but that's in rare cases. And also nebulizers and bronchodilators are going to help just because of the bronchiolitis, like you mentioned. That'll expand those bronchioles and kind of help the kid breathe a little bit, maybe even get out those secretions.
Well said.
Yeah.
Same thing for low urine output, right? Like you said, dehydration. If your little baby's having a dry mouth, they're not peeing as frequently, or it's not as much. I don't know, maybe you could weigh the diaper or something. Hey, man, this diaper is a little bit light. Those are all signs that, hey, dehydration, and let's be proactive so things don't take off for this RSV.
Yeah, exactly.